Hi guys, today we're going to talk about another of the services that you can provide here at Chesterfield. As you can see, we'll be talking about endoscopy, in this case specifically gastroscopy. So basically endoscopy refers to the usage of an equipment like this one that is flexible, has a camera on the tip, and we can use it to video and have a visual appreciation of what's going on inside the horse. We usually tend to use it, grossly speaking, for one of two areas. We'll either be scoping the gastrointestinal tract, more specifically the stomach. If we suspect that the horse might have gastric ulcers, it's usually the most common reason why we do it, although not the only one. Or we will be scoping the airways if we suspect that the horse has an airway disease, like for example pneumonia, COPD or equine asthma, or if the horse has suspected strangles. We will also use endoscopy to go into the guttural pouches, which are a compartment of the airway system, and check how they are looking. In this case, we are doing a gastroscopy to check for gastric ulcers. And basically, the procedure will involve the sedation of the animal. We always have to do it, or we always try to do it on stocks. We will usually do it in the dark, so you can see the camera better. Today, for the purposes of the video, we will do it with the lights on before we turn them off. Okay, we just arrived to the stomach. So we'll sedate the horse, put a gag on, so in the odd chance that the camera, as the horse swallows, the camera goes into the mouth rather than the esophagus. He won't chew the camera, provoke damage to the equipment and to himself. And then one of the assistants, in this case the vet Amber, will be sliding down the tube as I operate the tip of the tube with this funny looking piece of equipment. So basically you can tip and twist the tip of the camera in nearly every single direction, so you can actually have a look around an internal organ and see how they are looking. In the stomach in specific, we will be looking at the two main areas, which are called the margus plicatus, which is the area that separates the two sides of the stomach, the glandular side and the non-glandular side. And then we'll be looking at the pylorus as well, which is the exit. Those are the two most common areas where you will see gastric ulcers showing up. As you do and as you enter the stomach, you will try to get a good angle so that the top of the stomach matches the top of your image, so you are not upside down. Then you will carefully fill up the stomach with air. Hopefully the horse will have been starved for more than 12 hours, which is the case for Diamond here. Which will mean that the stomach is very empty but also very contracted. So you need, in order to see the full length of the stomach, you will have to fill it up with some air so that the folds of the normal folds and wrinkles of an empty stomach will not hide a gastric ulcer. So that's what I'm doing now. I'm just filling up the stomach a little bit more. That's not a problem, because in the end we will be taking all that air out as well. So as not to have any consequence from it, like colic. Once you think that the stomach is sufficiently filled up with air, you will start to systematically and carefully appreciate every single area of the stomach, looking for any suspicious lesions. They will always show up as a wound, really, in the stomach. It can be sometimes tricky to maneuver inside the horse's stomach. Obviously we are trying to work from afar, but eventually we will get there, see everything, record the images in the machine, and then in the end remove all the gas, take everything out, and will know whether the horse has gastric ulcers or not. Another thing that we will be doing is sometimes you will see pieces of food stuck to the gastric wall, and we will use this syringe with the help of to just flush that bit, because sometimes it can be misinterpreted as a lesion. So you see a dark area in the gastric wall, you don't know if that's a piece of food or if it's or if it is an actual lesion. So you flush it, if it goes away, it was food, if it doesn't, it might be a lesion. So, reasons to perform these. Usually we will perform a gastric ulcer or a gastroscopy if we suspect that the horse has gastric ulcers. As I said, the main signs that lead us to believe that the horse has gastric ulcers will include a horse that is more grumpy than usual, poor performance in the saddle, a horse that is girthy, although that's not the only reason why a horse might be girthy, a horse that has been progressively losing weight over time, or a horse that has developed a selective appetite. So certain types of food, they will stop eating them, especially if they are rich in sugar, because the sugar will decrease the pH of the stomach, so the stomach will become more acid, and that will hurt for the horse. So the horse will naturally start feeling less tempted to eat these sugary feeds. Okay, so what we have here is an area, not just one lesion, but one area of the stomach that is showing signs of ulcerative syndrome. So all that red bit that we see, bring the camera back into view. So all this bit here and that bit there on top, all of that will be signs of an ulcerative syndrome. So that goes, it's not just one ulcer, that's probably several ulcers that have come together and created one big lesion. And if we were to begin with, all this red area was similar to this more yellowish area that we see here, but as we flushed, the yellow bit went away and it uncovered these superficial but extensive lesion in the stomach. These would be enough to warrant treatment. So let's just record a couple of good images there. So we can, in 4 weeks' time, after treatment, repeat the gastroscopy and compare today's pictures with what we see afterwards. Okay, that's it. Okay, so we are now in the stage that I mentioned before. We are just pumping out the air that we previously injected inside. In this case, that will be the final stage of our examination. We will just be pulling the tube out in a second. In this case, we did discover that this horse had gastric ulcers both in the squamous and the glandular part of the stomach, so we will have to put him on treatment with some omeprazole and sucralfate. That is one of the several options that we have at our disposal. We'll do it for 4 weeks' time, and in 4 weeks we will repeat the procedure, and hopefully we will see an improvement which can be 100% better than it is now. So they, especially the ones on the squamous, so the non-glandular part of the stomach, tend to recover completely. The ones on the glandular part of the stomach might be a little bit more frustrating to deal with, but anyway, we'll need to recheck it in 4 weeks' time. Thank you for watching, and I'll see you in the next videos.